Exposure therapy is somewhat nerve-wracking, but it's actually not as bad as people think. What most people think happens with exposure therapy is that if you say, for example, that you're afraid of needles, that the very first thing your person's going to do is stick you with a needle. And that is not at all how exposure works. What you do is you create this hierarchy where you have this tiered system of various levels of experience with the thing that you're afraid of. So you might scale it from 1 to 10. 1 being thinking about being injected with a needle, whereas 10 might be actually being strapped to a table, taking an injection. But you don't start with 10. You have to do what's called systematic desensitization, which is where we would do mindfulness exercises around thinking about being stuck with a needle until that is something that feels tolerable and something that you've desensitized yourself to the point where you would say like, okay, cool. Thinking about getting stuck with a needle doesn't really have an adverse response for me anymore physiologically. So now we can move on to tier 2, in which case then we build and we go to the next step, and then we systematically desensitize ourselves to that. And then you work all the way up to 10, so that at some point the idea of actually being strapped to a table and being injected with a syringe is not anxiety. It might be a little bit anxiety inducing, but it's not, you're not going to be panic stricken because of it. So if you have a good therapist who knows what the hell they're doing with an exposure, that's how they're going to do it.